Okay, so this is your stethoscope, and this right here is going to be your diaphragm. In order to properly wear it, you're going to open it up, place it on the inside of your ears, and place the diaphragm out and place it where you need to on the patient. Let me wrap it around when you're not using it. The stethoscope is used to auscultate the sounds that are in your heart, your abdomen, and in your lungs, which allows you to check breath sounds, your blood pressure, and your pulse. Between each patient, you need to clean your stethoscope because it could be a form of transmission of infection between patient to patient, and you want to avoid that at all costs. Next is going to be your pulse oximeter, and this measures the percentage of the hemoglobin saturated with oxygen, and it measures how much oxygen is in the blood. In order to put it on a patient, you want to place it on a translucent site, which can be a finger or a toe, and you clip it, press your button, and wait for the information to pop up and write down whatever you need. Some possible errors for the pulse oximeter would be a fake nail. Its thickness could probably make your data inaccurate, or it just won't be able to read it. Lastly is your sphygmometer, and this right here is going to be your cuff. Then you have your bulb with your pressure valve, which twists to lock and to deflate. Then you have your pressure gauge, and then within your pressure gauge you have your pressure needle. Okay, to properly place the sphygmometer, you're going to take the inside of the cuff and place it on the patient's arm, wrap it around, and then you'll take your bulb and you'll begin to inflate. You can check the pressure on your pressure gauge and look at the pressure needle, and then once you're done, you'll take the pressure valve, untwist it, and it will begin to deflate.
Hi there, I'm Kaylee. I'm going to be taking care of you today. Can I get your name and your birth date, please?
Hi, my name's Veronica. My birth date is 2/13/1944.
Awesome. Hi, Veronica. How are you feeling today?
Pretty good. I'm ready to go home.
Me too. Well, I just wanted to come in and get your bed ready, get your bed real set up. Get this bed lower for you, just in case you need to get up and go to the bathroom. Also, I'm just going to throw these shoes in the closet just so there's no risk of you tripping over them. Here is your bedside table. And this is going to be your remote. The red button is how you're going to get a hold of me, and everything else is for the TV. I'm going to set your fall button on the bed. And is there anything else that I can get for you before I step out?
Nope, that's good.
Awesome. Thank you.
So when it comes to hand hygiene, you're gonna have 5 moments for washing your hands. 1, before patient contact, and that's where you wanna use your soap, you wanna lather your hands up, get some warm water going, at least 15 seconds, and before you're entering the patient's room. 2nd would be before cleaning or any aseptic procedures, such as putting gloves on or inserting a Foley. 3, after bloody or bodily fluid exposure, such as waste or after wound care. 4, after contact or touching the patient, like after taking blood pressure or their pulse. And 5, after contact with anything in the patient's environments, such as like their bedside table or any of their personal items that they're going to be touching a lot, because it's going to be putting their infection or their germs or their bacteria on those, onto your hands, and then to other patients if you're not taking care of them. ABHR and hand sanitizer can be used for all 5 of these steps, preferably soap and water or for before going into the patient's room, because you can thoroughly get the previous patient's germs and everything completely off. For ABHR and hand sanitizer, make sure that your jewelry is removed, because germs and bacteria like to hide in the crevices in any way that they can to survive, and they can easily hide underneath them. You want to apply 1 to 2 pumps of the ABHR or the hand sanitizer, and you're going to rubber it thoroughly just like you would with soap and water. You want to get in all the cracks and the crevices in your nails beds, on your thumbs, even on your wrists a little bit, and then you're going to keep doing this until that it's completely dry. because if it's wet and you touch something else, it's just spreading everywhere, and you need to continue to do it for at least 20 to 30 seconds or until it's dry. You also want to make sure that you don't use a paper towel to dry your hands, that you want to let them air dry your hands. So like I just said, just keep rubbing until they're completely done, and it can be used for those 5 steps, but it's preferred to have your hands washed before the first. Washing your hands with soap and water. So you're going to get 1 to 2 pumps of soap and allow yourself to get in all the nooks and all the crevices. Get between your fingers up here, press into your thumbs and your fingernails. You're going to keep doing this until the soap has completely covered all of the surfaces on your hands. And you'll turn on the water. It needs to be at a warm temperature. And you're going to wash with your fingers pointing downwards and drain for at least 15 seconds, getting all of the bacteria and the germs directly down the drain. Between your cracks, crevices on your thumbs, up onto your wrists a little if you feel the need to. And just keep doing this. Then grab a paper towel, dry your hands, and use the paper towel to turn the faucet off.